Senior citizens lined up enthusiastically as India expanded its vaccination program for COVID-19 to people above the age of 60 and those older than 45 with medical conditions. It's a dramatic change in a program marred by vaccine hesitancy in recent weeks when it covered healthcare and frontline workers.
I haven't gone out for a year, and I feel safer to be able to move around a bit and without the fear of the virus.
Health authorities have underlined the need for inoculations as cases rise after a steady decline since September.
This marginal increase in certain states is a matter of concern. We cannot take it lightly at all.
Prime Minister Narendra Modi was among the first to get the shot this week. In a tweet, he urged people to do the same. He took a domestically developed vaccine that some had been reluctant to take because final efficacy results are not yet available. Covaxin is one of the 2 vaccines being administered in India. However, recent interim data showing that it is more than 80% effective could encourage more people to take the vaccine.
It is vital that we don't let this gain that India has made slip away and go Europe way, where after initial victory they are now facing a second lockdown.
The hope is that if India can inoculate enough people in the coming months, it could break the chain of transmission in a country where millions have already been exposed to the virus. It is called herd immunity.
We have learned from various community data that nearly 50% of the people in different states are already having antibodies to COVID. And if we add this segment to that, we might be hitting that 70% magic figure of herd immunity, which actually may reach us to the tipping point beyond which the COVID numbers may start coming down automatically.
Some have questions about the vaccines. Weary of the pandemic though, most are ready for the shots.
Even if it is good only for a certain period of time, even then I feel we should go for it. I certainly will.
Since it has to be done, I've taken it. But I don't know if I'm fully convinced that this is the best shot to take.
India's 2 advantages, a massive reduction in infections and ample supply of shots in the world's largest vaccine producer, have raised hopes of building on gains made so far in a country that has counted over 11 million cases. Anjana Pasricha for VOA News, New Delhi.